Cannabis. Cannabis use is among the most commonly used substances in Canada. In addition to potential therapeutic effects, there is substantial evidence that frequent cannabis use can cause health effects.
Abuse, liability, and dependence are central factors in substance use with important implications for risk perceptions.
Although the risk of dependence is lower for cannabis than other legal drugs such as nicotine and alcohol, it is estimated that approximately 9% of cannabis consumers will become dependent on cannabis in their lifetime.
Frequent cannabis use and higher consumption levels are important indicators of dependence as well as more general measures of problematic cannabis use. Recent research suggests that the risk of dependence may increase with the use of high-potency cannabis, which has increased over time. With its legalization and regulation in Canada in 2018, the proportion of Canadians reporting cannabis use in 2019 increased substantially over the previous year, with half of the new users being aged 45 plus years, while use in older adults has been low historically, as those born in the 1950s and 1960s continue to age. This demographic will progressively have more liberal attitudes, prior cannabis exposure, and higher use rates. Legalization has increased access to cannabis, resulting in potential benefits as well as potential harms to consumers, including but not limited to increased risks of substance use disorder, accidents, injuries, and presentations to emergency departments. Consumers may also hold false beliefs about the therapeutic effects of cannabis use. There is evidence for certain therapeutic effects of cannabis, including treating chronic pain, reducing chemotherapy-induced nausea, and vomiting and multiple sclerosis spasticity. However, increased marketing and social media presence regarding cannabis and CBD products have the potential to promote false or exaggerated beliefs. There is increased evidence that regular cannabis use, particularly in youth, may cause serious health problems including psychosis, anxiety, depression, altered brain functioning, and addiction, especially among those with predispositions. The likelihood of problematic cannabis use and long-term health effects is also associated with early initiation and frequent cannabis use in adolescence.
The use of cannabis is highest among the people who are aged 20 to 24 years, followed by those 16 to 19 years. Males reported a higher percentage of cannabis use in the past year compared with females. Social acceptability is one of the reasons of high cannabis use, where most of the people accepted cannabis just after alcohol. Legalization of cannabis is the main reason of cannabis use, especially among youth. Cannabis use disorder in 18 to 24 years old has increased since it got legalized. Hospitals have seen massive increases in ER visits for cannabis-induced psychosis, severe vomiting, and acute pregnancy care. After legalization of cannabis, second-hand cannabis smoke or vapor increased surprisingly in public places, home, cars, workplace, and even in schools. Smoking is the most common method of cannabis consumption. Other methods of consumption including eating it in food, vaporizing using a vape pen or e-cigarette, ingesting cannabis oil, drinking it, and applying to skin.
Individuals who use cannabis may do so for a variety of reasons, such as recreational use to enjoy a good time with friends, relaxation from a stressful environment, experimentation for those who wish to try, or medical use to treat pain or other symptoms. One of the downsides of cannabis use is the potential for addiction. Since cannabis became legal in Canada in 2018 as a recreational drug, it may be very difficult to stop individuals from using it and being hooked by cannabis. The Canadian Centre for Substance Use and Addiction is a non-governmental organization who provide national leadership on drug use, and they have a website where cannabis dependent can get support if they're thinking about quitting, and would like some advice on how to get sober. I will show you a video, and in this video, it will show you the ways on how to reduce the risk of vaping cannabis.
Vaping cannabis may be legal when you're 18 or older, but it still comes with risks to your physical and mental health. If you're thinking about vaping cannabis, here are some things that can help lower your risk. Delay using cannabis for as long as possible. The earlier you start, the greater your risk of experiencing health problems. Space out your cannabis vaping to give your lungs a rest and keep the THC level under 10%. If you choose to use cannabis, don't mix it with other substances, like alcohol. Mixing substances can cause unwanted side effects that may need medical attention. Not all cannabis products are made equal. Cannabis from illegal sources can be contaminated with other substances, and its quality can't be guaranteed. This can put your health at risk. We don't yet know all the long-term effects of vaping cannabis, but we do know that it comes with risks for your physical and mental health. Get the facts, know the risks. For more information, visit ccsa.ca/cannabis.